India's total fertility rate is declining, signaling a major demographic shift that will shape its future economy and society. TFR refers to the average number of children born to a woman during a lifetime, and India is now trending close to or below replacement level in many states. This is not an isolated phenomenon. Japan is one of the strongest examples of a country struggling with extremely low fertility and rapid aging. Its working age population has shrunk for years, putting pressure on its economy and social security system. China too, after decades of the one-child policy, is now facing a declining population and has started encouraging higher birth rates, but without major reversal so far. For India, the decline brings both gains and risks. It can reduce resource pressure and improve living standards, but it also raises concerns about future labor shortages and an aging population. The challenge is to balance this demographic transition with job creation, productivity and long-term economic planning. Sumit Peer, political commentator, in fact, is joining us live. Also with us is Arun Kumar, senior economist, Dr. Archana Bajaj Dhawan, gynecologist, joins us live. Professor Madhav Nalapat, editorial director of the Sunday Guardian, is also with us on the broadcast. Professor Nalapat, if I can begin with you first, what do you make of this? Okay, I think we've lost Professor Nalapat there. Sumit, let me try and draw you in here if you're there with us. Sumit Peer, on this statistic emerging, how concerning is this? Should alarm bells be ringing already? With regards to this decline in fertility rate and the fact that it's actually, gone below levels which could lead to significant changes, perhaps a decade or 2 decades down the line in our young population.
Uday, thank you very much for having me on your show. Well, it's a very beautiful question. Let me try to put some facts and perspectives. There are two dimensions to it. One is purely mathematics, second is political dimension. Let's start with the mathematical dimension. Look, when we see a declining population, eventually down the line, your median age will come up, your people available for the workforce will be less, and the people who are going to get benefited will be much more. That is what has happened in Japan, China, and everywhere. But what I see, today we have the median age as 28 years. We have a 70 years of youth, demographic dividend. We are talking, we have more kids in the school than the population of United States of America. And these all add to our economic outlook. They make the country and the economy robust. Though per capita is always a challenge with the bigger countries, but overall the country is doing well. We are the fastest growing major economy in the world. That is the mathematical part of it. Now look at the political part of it, Uday. First of all, we recently, there was a survey out wherein it was said that the Hindu population has decreased by around 7 or 7.5%, and the Muslim population has increased by 20 or 30%. So eventually, even if you look at 1.9, the replacement rate, what is the replacement rate of Hindus and what is the replacement rate of Muslims? That's also a concern which we need to really find out. And if you further go deep, and if you look at places like Delhi, where it says the replacement or the TRF has come down to 1. That is, most of the couples have one child, and which we see a lot of couples around us. So which might not be only Delhi phenomena, it might be across all the metros. So overall, if you look politically, I think it's not only the population of the country or the replacement rate of the country which is coming down, it's also the Hindu fertility rate which is coming down drastically over than the Hindu population is decreasing. And whatever demographic we have, whatever politics of the country is prevailing, when the demographics change, the politics of the country changes. And let me draw your attention, sir, to a very important fact. Look, another 2 decades, India will peak. Another 2 decades, Bangladesh will peak. But there is one scary phenomena here. Pakistan is growing at 3.4%. They will never peak. So 25 to 30 years down the line, Uday, hear me, well. The total amount of Muslims in India, Pakistan and Bangladesh will be just 10 to 15% less than the total Hindu population of India. So that can lead to a paradigms, that can lead to things which can, completely change the future dynamics and future politics of the subcontinent and the Indian subcontinent as such, because the difference will be only 10 to 15%. So this is not a small thing, Uday. This is a very alarming situation from a mathematically, from a statistically, and even from a political things, because I am not talking of 100 years down the line. I'm talking of just 25 years down the line. Broadly, I'm talking about 2050. That is the number, or just 25 saal. Down the line, this is a scary phenomenon which can happen, and there can be somebody who can say, let's combine the countries, and when the Muslim populations rise, there is no secularism, there is no democracy. It happens in most of the parts of the world, and when it crosses 51, it can be leading to Shariat. So are we looking 50, 60 years down the line with a redrawn borders and maps to a Shariat here? That is something which Hindus should be very scared about. That is what the government of the day should take note about. And that is what all these modern couples who believe that only having one child is something very good and they're doing a great service to the nation and to the community and the country, that should really think about, because your rights, your duties, the country you live in, and the
Yes.
democracy you have is only up to the time when you have the demographic dividend with you.
Okay.
The day demographic dividend is gone, you see around the world, Uday, everything disappears.
Okay. Let me, in fact, quickly also draw in at this point Arun Kumarji. Arun Kumar, as far as, of course, you're concerned, what do you make of this statistic, this development? Also, what are likely to be the economic impact if this trend continues and no steps are taken?
Thank you for having me, and good evening to everybody. The first point is that, you see, these are socio-economic transformations that happen as a country develops. This happened in Europe, this has happened in Japan, Korea, and various other countries. As prosperity comes, women have fewer children. That's what you see in the advanced countries where, the fertility rate had dropped much earlier. And therefore, what had happened was that the young population as a proportion of the total population came down. Now, why is that important economically? There is something called a dependency ratio. How many people are working and how many people they have to support. So the elderly people above the age of 64 and young children below the age of 15, they have to be supported by those who are working. The ILO's definition of people in the workforce is 15 to 64. Our Indian definition is 15 to 60. But according to the ILO definition, what has happened is that now many more elderly people are there and many more children are there, and therefore the young people have to support a lot more. This is what's the problem that South Korea, Japan, Europe, and various other countries are facing. But in India, our problem is that our education levels are very, very weak, and that's why large number of children are underemployed and unemployed. In other words, they also have to be supported by those who are getting work. So if you look at the unemployment statistics, that is quite an important thing, because if children in the age group of 15 to 29, large number of them are not getting job, or they're getting job much below what their level of training is. And therefore they're quite dissatisfied. Women's participation in the workforce is also very small compared to the men. Women are not getting paid work, they're doing unpaid work at home. Now, when they do unpaid work at home, then there's a stress in the family. And then because of that stress, probably also they have fewer children. So you see this across the board. And I must mention that, while the Hindu and Muslim population growth rate was quite a bit of a gap in the 1990s, they have become almost close to each other. So in India, if the present rate of growth of Hindus and Muslims continues, even in 2,500 years, the Hindu and Muslim population will not equal each other. So in other words, let's leave that aside for the moment. The real worry is between the northern states and the southern states, or the more advanced states and the backward states. The more advanced states of the south and the west, whether it be Tamil Nadu or Maharashtra, etc., there the decline had taken place much earlier. And that's why their share of population in the country has gone down, where the share of the northern states like UP, Bihar, etc. has gone up very substantially, because here the fertility rate is much higher. And therefore now we are having a problem of, federalism. Because in the government wants to do, the redoing of the constituencies and so on. In that, the southern states feel that they're going to lose out compared to the northern states. And they feel that they get even more marginalized. Now, to me, this is a bigger challenge, because this affects the federalism of the country. We are a combination of large number of very diverse states. The problems of Tamil Nadu are not the same of Himachal, problems of Assam are not the same of Gujarat. They're all very diverse. And therefore, we need to stick together. We need to take the diversity into account. Otherwise, we'll be running into problem of federalism, and there'll be, already the problem that, in
Yes.
Andhra, now Chief Minister has said that women should have more children, Now, another factor that's very important is technology. With technology, what happens is productivity goes up. Now, how do we tackle that? Because even though the dependency ratio is rising, will the technology enable the working population to be able to support more people, because the productivity will rise? So I think we need to take that into account. We need to take unemployment into account, and our unorganized sector, which is 94% of the workforce, that is where the poverty is, and that's why people are shifting from rural to urban areas. and they come as single people. And when they come as single people, then the fertility rate will obviously go down because the whole family doesn't shift. So in other words, there are these socio-economic factors which we need to take into account and look at the dependency ratio, which is also a problem, because then if the dependency ratio rises, then the working population has a greater burden. So many of these factors need to be taken into account.
Okay, let me draw in Dr. Archana now on why this is really happening. Why are we seeing this decline in fertility rate, Dr. Archana? What explains this trend? Also, we're seeing it in cities like Delhi. Delhi actually now has the lowest fertility, amongst the lowest fertility rates, not just in India but across the world.
Thank you so much for having me in the show. And much as I'm petrified by hearing what my previous speakers have to say about the shift in the various kinds of populations, etc., to me as a doctor, from where I understand things, we are relatively a young population where our younger women are getting better educated, they are reading more, they are well employed, they're getting married late. So when this sort of a scenario happens, the next automatically, the next corollary to this is if you're getting married late, you're financially more enabled, you also have a way of looking at things which is different from your previous generations. So to most women who are working, who are financially independent, who have traveled to study abroad, who've been to good colleges here, now understand that if they have too many children, they're going to have that many, children to groom. They're going to have that many children to send to schools. Education in metropolitans is expensive. Bringing up children is very expensive. I'm a grandmother to 2 little grandchildren, and I can tell you how terribly expensive it is if you want to give your children the kind of grooming that we have got. So for women who are educated, which I'm so glad that they are, this is a kind of a double-edged sword. As the population advances, we will, as the first speaker very rightly pointed out, 2050 we will have a scenario where things will be completely different. But as of now, to most of the younger generation, to the ladies in their late 20s, 30s and 40s, to be able to have to just bring up the one child, to groom that child well, seems like a much better option than having 3 children running helter-skelter, not being able to earn, not being able to support the family, not having that double income. So overall, this conundrum of, expectations, deliverables, everything is adding up, and it's leading to the educated women doing lesser babies. And of course, which has its own bright sides if we look at things now. But in the larger picture of things, this may not be the best.
So since of course you're someone who's in the field almost every day, you're a practicing gynecologist, you are not surprised, Dr. Archana, at this statistic that has come out. I mean, this is in line with what you see perhaps on a daily basis and what you hear from others as well, who come to you. So this trend does not surprise you. It is what you are observing as well. Then my next thing, is it a good thing or a bad thing according to you?
Well, in some ways, it's a very good thing for the moment. It's a good thing for the moment because mortality rates, maternal and infant, are coming down. The children who are being reared now are better educated, they're better fed, they are not anemic, they're not malnourished. So a lot of things in that perspective look very bright. But if we were to look at the larger picture of things, what is eventually going to happen? There's going to be just this hugely aging population, very little people in the working age group, and sooner than later, we are going to have a population which will not be able to replace itself, unless, of course, we have an exodus of people into the community, and nobody actually decides to ever travel and work abroad. In that sort of a scenario, maybe things might still show up a little better, but on the larger picture of things, the scenario is going to be quite worrying. Say about 2-3 decades from now, it will be worrying. It's not something that the Indian population is going to crash in a day. It's not something that's going to happen in a year, but definitely if this trend continues unabated, and more than unabated, it has to be this equality between the various demographies of the country. You have a Delhi with a 1.2, you have a Jammu Kashmir surprisingly with a very low fertility index. Then you have the down south states where women are having less children, but where The need is the most to, sort of strike a balance between the number of children you produce and the number of children you sort of scale down is the states like UP and Bihar, where unfortunately it's still not happening at the way it should. Of course, if we look at the 50s, where we had a fertility rate of 6 and this coming down to about 3 in Bihar now. So things are improving, but then, this divide has to be consistent across the country.
Okay. Sumit, let me draw you in here. And, of course, we are seeing this happen in Europe, also China, Japan, and there are, warnings there which we perhaps can learn from. Right now, experts say it's not too late. Things can be corrected. Sumit, should they be corrected? And how can they be corrected?
I think, Uday, it's a writing on the wall. I mean, the people who don't learn from history, the history repeats itself. The smart people learn from the mistakes of others. They don't fall into the ditch and then find out there's a ditch. Look, you and me have been on this channel for years now. And I speak direct because, there was a time nobody thought East and West Germany could come together. We have seen in 1971 Bangladesh breakup. We have seen Pakistan breakup. So today, if countries are breaking up and coming together, we have seen today Russia taking 33% of the Ukrainian land and saying it's mine. We are seeing what is happening in the Middle East. So geopolitical tensions and fiascos are happening. There are a lot of people who want to destabilize this country. And let me be very candid and direct. There are only one country which has sustained Islamic invasion. That is we Hindus for last 1,000 years. So today, if you look at the boundaries of India, it might look very hunky-dory and it might be all good and covered. But what Dr. Saab rightly said, I've been all the numbers, 25 years down, for 25 years down the line, things might not look so hunky and dory. There might be a leader who may emerge and say, let's get these three countries together. What will happen to the Hindus? You want to be left with 10% margin over Muslims and the fertility rate, another 10 years, you are less than 50%. Then you know what happens in Pakistan, you know what happened to Hindus in Afghanistan, you know what happened to Hindus in Bangladesh for that matter. Why is Hindu Kush called Hindu Kush? Because it's a slaughtering ground of Hindus. That is what it means in Pashto. What is happening in Pakistan every day we see what is happening in Bangladesh and all. We keep on discussing that. So the problem here is it is not only a mathematical connotation, there's a political serious ramifications for the Hindus of this country, and there's a time for the Hindus to really wake up. It is not a choice not to have two kids. I think at least we should have two kids per family, at least at 2.1, 2.2, you just replace. But if you're coming to one, then imagine, I'll tell you another scenario, Uday. There's a child, only one child. So what happens next? Next generation, no Masi, no Chacha, no Mama, no Bua, nothing. There is no relation. There's only one relation. All other relations simply disappear. So the social net or the social security, what we talk about, which Indians used to brag about, we have a very powerful, this all fiddles down. So, you have no brother, you have no sister, nobody to fall back upon, no Chacha, no Mama, no Bua, nothing. So all that Hindu ethos and family, which is all going to dwindle down. So what I would request, at least you all have, I have two kids. We all have, my wife is working, everybody has, their wives working and all. But at least without two kids, we are really bringing down the civilization. That is what I want to be very explicit and direct.
Yes. Arun Kumar, do you believe this will then, if not corrected, lead to over time less workers as well, less employees as well? Will this then hamper the service sector? Do you believe the young population going down also will have its economic impact? Right now, people look at numbers and look at investments into India. Could that also take a hit? Arun Kumar, what would you advise right now as a senior economist as the steps that possibly can be taken immediately, if it is a big concern for you as well as it is for other experts?
So, India's population will keep on expanding till almost 2060 to about 1.65 billion people. We are at about 1.46 billion at the moment, given the present situation. But, major changes are coming ahead of us, whether it's AI, whether it's environment, whether it's the global situation. So we are unable to predict, but we can only project from where we are at the moment. Now, therefore, the young population will keep expanding, but the senior population will expand even faster. And therefore, as I said in the beginning, dependency ratio, that will increase. The dependency ratio means for each working person, how many people do they have to support? Now, this dependency ratio, if it keeps increasing, it will mean fewer and fewer people will have to bear the burden of those who are not able to work. So we may have to change our retirement age also, because at the moment people are able to work, we retire people at 60, 65, whereas people continue to work at 70, 75, given the longevity has increased. We also, fixed this retirement age of 58 years and 60 years in the 1930s, when the longevity was only 35 years. People used to mostly die, by the time they were 50. So there were very few people to support. But now people live up to the age of 72 or so, longevity has gone up. So they're going to survive till the age of 90 or thereabouts. And that's why, you'll have many more people who are dependent. So in other words, increasing the retirement age will do two things. One is more people will be in the workforce. Second is that, the support for the elderly, that will actually be less, because they'll be earning and they'll be able to save, and therefore they'll be able to support themselves. Second is technical change. As I said earlier, technology is changing very rapidly, and that would enable a lot more people to work. Whether it be the elderly who are above the age of 60, they would be able to work also much better. And then, as doctor mentioned, many women, they don't want to take on the burden, because they actually, want to have a career. They don't want the burden of both the family and the children. So we have to recognize that those women who are doing free labor at home, their work should be counted in the GDP. They must be given some benefit, like in New Zealand and other countries, so that even if you're simply a homemaker, so you should encourage people to be homemakers, then they'll be willing to take on the burden of children. So that could be one possible scenario that we could think of, where we begin to give women who bring up children, give them. Then I think maternity leave and other such leave, those should be more liberally given, so that the women can take care of children for longer time. At the moment, you get only a few months time, which is totally inadequate for child rearing. Also, the attitude in society must change. At the moment, the ratio between men and women is very adverse to women, and that actually reduces the number of people. So our attitude in society that we must have boys, that attitude has to change. Because if that attitude changes, then there'll be more women and there'll be larger increase in the population. And also, if women feel wanted, they'll be more happy. At the moment, a lot of women feel that they're not wanted, that they are, actually a burden on the family and so on. That kind of thing must go. Then only, I think, women with more dignity, they will be able to survive better. So there are many things in the socio-economic framework in India that need to be changed. I think these things have changed in the West. They have changed in Japan, Korea, and so on, where women have much more dignity than I think our women have. There's a lot of women who are, in marriage also, they're unhappy because of dowry, etc. We must tackle these kind of social evils also, so as to improve the position of women. So the socio-economic transition, as people call it,
Okay.
the social factors, the economic factors, they must be
Yes.
taken into account. And we must be very mindful of the north-south divide that is coming up. That could be a huge political challenge
Yes.
for the country.
Is this something also you observe, Dr. Archana, that there are different rates, there are different trends in metros, there are different trends in north of the country, in south of the country?
Absolutely. I think, if I'm not mistaken, we had a couple of years ago, we had a program on your channel itself where we were discussing about the declining fertility rate in Jammu Kashmir. So if we look at the broader picture of things, it is the states up north, the metros, the cosmos, where the fertility rate is declining rapidly. And there are a number of factors which play a role, which we've all highlighted in the previous conversations. But another aspect which I think which we need to look at very seriously is how much support are we giving the working women. This is eventually going to be a very big population of our female subfraction. Women who are working need more flexibility at work. They need better child care. If you have an organization where there is a reasonable creche attached, so I'm sure women will be a little more forthcoming in getting their children right around them, and as a result having more children. And as Sir just highlighted, better paternity and maternity, of course, definitely, but better paternity leave options, this will help definitely. And of course, education is going to be the key. Educating, if you look at all the places which have a lower fertility rate, there is one thing which is running commonly across the women there, and that is better education. So where women are better educated. They tend to get married later, procreate less, want to spend less time in rearing children, and want to spend more time in a profession, in a career, and in equating their finances. So better access to resources to women where they do not have education so easily available. I think that is going to be the key to changing the entire scenario. So women across the country need to have better healthcare facilities, they need to have better childcare facilities, and they need to have better education facilities. So this inequality in the fertility rate will hence decrease, may at some point become zero, and of course women will feel more confident of themselves and hence more confident of rearing children.
My thanks to all of our guests for joining us. We've run totally out of time. We're going to now be slipping into a very short break, but the news continues on the other side on NewsX. Don't go anywhere.